If you're over 60, listen closely. Did you know that just a handful of tiny nuts, something you probably think is healthy, could actually be silently harming your heart, your memory, and even your bones? Sounds unbelievable, right? But I've seen it happen many times over the past 20 years as a doctor. One of my patients, Lorraine, 72 years old, completely changed the way I think about nuts. She was still sharp and active, but constantly tired. Her legs felt heavy, and her memory was foggy like a misty morning. When I asked her what she ate every day, she proudly said, "Only nuts, doctor. Almonds, cashews, peanuts, macadamias, all healthy stuff." But those very nuts were the hidden culprit behind her decline. The truth is, after age 60, your body doesn't work the same way it used to. Foods that once supported your health can turn into enemies. A 12-year study from the Journal of the American College of Cardiology found that some common nuts may increase the risk of heart failure in older adults by up to 48%. That's not a rumor. It's proven science. If you ignore this information, you might be unknowingly speeding up aging, weakening your bones, clouding your memory, or worse, facing serious heart problems. But don't worry, I'm here to help you avoid those mistakes and discover the best nuts to keep your body strong, your mind sharp, and your heart healthy. Today I'm going to share with you 4 amazing nuts that anyone over 60 should add to their daily diet to protect their brains, heart, and bones. At the same time, I'll warn you about 4 nuts that seem healthy, but may actually be quietly harming your health. And most importantly, I'll reveal one popular nut, often praised as a superfood, that has been linked to liver damage, kidney issues, and cognitive decline in seniors. You'll be surprised to learn what it is, so make sure to watch until the end so you don't miss this crucial information. And if you want more health tips to help you thrive in your golden years, be sure to hit that subscribe button now. Let's begin this story with a tiny but mighty nut, often called the king of nuts for senior health, the Brazil nut. Have you heard of it before? This nut isn't just delicious, it's a nutritional treasure, especially once you're over 60. I remember the first time I suggested that Mrs. Lorraine change her nut-eating habits. She looked at me skeptically when I said, "Just one Brazil nut each morning and you'll notice a difference." Just one nut? Yes, exactly. Brazil nuts are small, but they pack extraordinary power thanks to one special nutrient: selenium. Selenium is a trace mineral your body needs to keep your thyroid functioning smoothly, your nerves healthy, and even to slow down cellular aging. Just one Brazil nut provides up to 137% of your daily selenium needs. You heard that right. Just one nut is enough. I saw this firsthand with Mrs. Lorraine. She was showing signs of a sluggish thyroid, fatigue, slow metabolism, and a low mood. No medications were needed, just one Brazil nut a day. The selenium in Brazil nuts activates thyroid hormones, which regulate everything from your body temperature to your mood. It also protects myelin, the fatty sheath around your nerves that helps your brain send signals faster. When myelin weakens, your reflexes slow down, your balance suffers, and your memory fades. What's fascinating is that selenium from Brazil nuts is 3 times more absorbable than from supplements. Your body knows how to use it more efficiently when it comes from natural food. After just 2 weeks of eating one Brazil nut each day, Mrs. Lorraine told me, "Doctor, I woke up this morning without needing 2 cups of coffee." By her 2-month follow-up, she had lost 9 pounds, was sleeping better, and her blood tests showed that her thyroid was back in balance. We didn't change her medication, just added one tiny nut. But that's not all. Brazil nuts also support gut health, reduce sugar cravings, and even protect your telomeres, the caps at the end of your DNA that determine how fast you age. In folk wisdom, they say eating a Brazil nut is like drinking a glass of youth elixir. Science agrees. However, I must warn you, don't overdo it. 2 nuts a day is the limit, because too much selenium can cause nausea or nerve damage. I always recommend buying Brazil nuts in their shells to keep the oils inside fresh longer and storing them in the fridge. Pre-shelled nuts often lose nutrients after just a few weeks. If you want a small habit with a big impact, start with one Brazil nut each morning. Next, let's talk about a nut that looks special the moment you see it. Have you ever noticed the shape of a walnut? It looks just like a tiny brain. There's an old saying, "You are what you eat." And maybe it's no coincidence that Walnuts are the best friend of memory and brain health, especially for those over 60. This nut contains ALA, a plant-based form of omega-3 fatty acid that your brain's neurons need to repair, regenerate, and function properly. Our brains begin to shrink after the age of 50, but proper nutrition can slow that process, and in some cases, even help restore what's been lost. A study published in the Journal of Nutrition found that older adults who ate about 40 grams of walnuts daily for 8 weeks improved their information processing speed by up to 22%. That's not a small number. It's enough to feel the difference when you're having a conversation, solving a problem, or trying to remember someone's name. I had a patient, Mr. Fidelia, 68 years old, who often forgot the names of his friends and said his mind felt foggy. He didn't want to take medication, so I suggested he eat 5 to 7 walnut halves each day. Just 1 month later, he smiled and said, "Doctor, I can remember both my grandkids and my old friends' names again." Walnuts don't just nourish the brain, they also protect it. They're packed with polyphenols, powerful antioxidants that can cross the blood-brain barrier and reduce inflammation, a key factor in Alzheimer's and cognitive decline. Each handful of walnuts acts like a shield for your memory. And if you struggle with sleep, a common issue for people over 60, walnuts might be your secret weapon. They naturally contain melatonin, the hormone that helps you fall asleep and stay asleep. I often tell my patients, instead of reaching for sleeping pills, try eating 5 to 7 walnut halves before bed and cut down on screen time. The results are often amazing. But walnuts don't just benefit your brain and sleep. They're also good for your heart. Rich in arginine, an amino acid that helps relax blood vessels, walnuts improve circulation, lower blood pressure, and deliver more oxygen to your brain and muscles. That means you'll feel lighter and less tired when walking or doing chores. Here's a quick tip. Store walnuts in the fridge. The oils in walnuts can go rancid at room temperature, and the bitterness you sometimes taste is a sign that the oil is oxidizing. But don't let the slight bitterness scare you. It's often a sign of even stronger antioxidants. If you want to keep your mind sharp, sleep well, and maintain a strong heart, make walnuts a daily habit. Just a small handful, about 5 to 7 halves, is enough to make a difference. But don't stop here. We still have 2 more amazing nuts to cover, and 4 you'll want to avoid to protect your health. Stay tuned to discover them. Now you've learned about Brazil nuts and walnuts, 2 superheroes for brain health, heart function, and sleep. But our journey isn't over yet. If you're over 60, you need to understand that every food choice you make can either strengthen you or quietly lead you toward unexpected health problems. Imagine you're walking down a path, and each nut you choose is a step. Some steps will lead you toward clarity and vitality, while others might cause you to stumble with joint pain, weight gain, or even more serious issues like liver or kidney damage. So, walk with me as we uncover the next 2 amazing nuts and start identifying the enemies hiding among the nuts you may be eating every day. Let's talk about a tiny yet powerful nut, the almond. This isn't just a tasty snack. It's a warrior for your bones and heart. Just a quarter cup of almonds, about 15 to 20 nuts, delivers nearly 100 milligrams of calcium, an essential dose to help keep your bones strong and lower your risk of fractures from falls. But almonds offer more than just calcium. They're also rich in magnesium, which acts like a guide, helping calcium go directly into your bones instead of building up in your arteries and causing blockages. This magnesium also relaxes your blood vessels, lowers blood pressure, and helps you feel lighter and more at ease. I once had a patient, Mr. Farah, a retired carpenter, 70 years old. He had stopped climbing stairs due to cramps and poor balance. I didn't rush to prescribe medication. Instead, I recommended he eat 15 almonds every morning. 3 months later, he came back to my clinic, walking more steadily, wearing a bright smile. "Doctor, I've been walking every day, and I'm no longer afraid of stairs." That's the power of almonds. But I always remind my patients, choose raw or dry roasted almonds. Avoid the salted ones. Salt can cut their benefits in half. And don't peel off the thin brown skin. That's where you'll find flavonoids, plant compounds that protect brain cells from damage. When combined with the vitamin E in almonds, they form a powerful antioxidant duo that helps keep your memory sharp. Next, let's talk about a nut that's not only delicious but also a joy to eat, the pistachio. These green and purple gems aren't just pretty, they're heroes for your blood pressure, eyes, and blood sugar. A single serving of pistachios provides about 2,500 mg of potassium, a mineral that helps your kidneys flush out excess sodium, naturally lowering your blood pressure. They also contain lutein and zeaxanthin, two nutrients that protect your eyes from macular degeneration, a common issue for people over 60. What I love about pistachios is their hard shell. Cracking them open slows you down, helping you control your portions naturally. It's nature's way of saying, don't rush, enjoy the moment. Pistachios are also easy to chew, making them perfect for those with sensitive teeth or dentures. For anyone concerned about blood sugar, pistachios are an excellent choice. Each ounce provides about 3 grams of fiber, which helps stabilize your energy and prevent blood sugar spikes. I often tell my patients, try 15 almonds in the morning and 40 pistachios in the afternoon. It's not a diet, it's your health protection system. But be careful, don't buy pistachios that are salted or oil roasted. They can actually raise your blood pressure instead of lowering it. Now, we need to talk about the first nut on the avoid list. It looks luxurious, it's marketed as a superfood, but it may actually do more harm than good, the macadamia nut. This nut is rich, buttery, and delicious, and often sold at a high price, which leads many to believe it's one of the healthiest choices. But for those over 60, macadamias can be a burden. Just 1 ounce contains around 200 calories and over 22 grams of fat, most of it saturated fat. For younger people, that might not be a big deal, but at 60, when your metabolism slows down, this fat content can lead to weight gain, higher cholesterol, and added strain on the gallbladder. I remember a patient, Mr. Hillary, 67 years old, who frequently experienced stomach pain after snacking. It turned out he was eating a handful of macadamia nuts every afternoon. The saturated fat in those nuts was triggering gallbladder flare-ups, a common issue among older adults, especially those with undiagnosed gallstones. Macadamias are also dense and tough to chew, making them a poor choice for people with weak teeth, dentures, or implants. On top of that, many macadamia products are oil roasted and salted, which increases inflammation and causes water retention in the body. What's even more concerning is how easy it is to overeat them. Their soft, creamy texture makes it hard to stop at just 5 or 6 nuts. Most people eat twice that without realizing it. The result? More belly fat, higher LDL, bad cholesterol, and a sluggish liver. If you enjoy macadamia nuts, treat them like a luxury, something to savor on special occasions, not a daily snack. Especially if you're managing your weight, cholesterol, or gallbladder health, they're best consumed sparingly. Our journey isn't over yet. There are other nuts you may be eating, thinking they're harmless, that could actually be quietly harming your health. Keep watching to discover them, and make sure you're choosing the right nuts to help you stay healthy, active, and vibrant in your golden years. We've come a long way exploring incredible nuts like Brazil nuts, walnuts, almonds, and pistachios, trusty companions that help keep your heart strong, your mind sharp, and your bones sturdy after age 60. But now, it's time to confront the remaining hidden enemies. The nuts you might be eating every day thinking they're good for you, when in fact they could be silently harming your body. If you want to keep walking with ease, chatting with friends, and enjoying your golden years without worrying about joint pain, memory loss, or serious health issues, then the information ahead will be key. Let's explore together and make the right choices. First, let's talk about pine nuts. A tiny nut often found in pesto, salads, or trail mixes. At first glance, they seem harmless, even praised as natural. But for people over 60, pine nuts can pose some surprising risks. Have you ever heard of pine mouth syndrome? It's a condition where you experience a harsh metallic taste in your mouth that can last for days, or even weeks, after eating pine nuts. For seniors, this isn't just unpleasant. It can lead to appetite loss and unwanted weight loss. A major concern if you're already struggling with proper nutrition. Even worse, pine nuts can interact with nearly 60% of the medications commonly used by older adults, including statins, antidepressants, and blood pressure medications. They interfere with liver enzymes, making it harder for your body to process these drugs correctly. I once had a patient, Mrs. Venus, 65 years old, who suffered from joint pain due to inflammation. She loved trail mix that included pine nuts. When we removed pine nuts from her diet, her joint pain significantly decreased within just 3 weeks. That wasn't a coincidence, it was science. Pine nuts also spoil easily, and when their oils oxidize, they produce inflammatory compounds that can damage joints and blood vessels. So, if you're over 60, it's time to say goodbye to pine nuts. There are better, safer options out there to keep you strong and healthy. Next, we need to talk about peanuts, a nut that isn't actually a nut. That's right, peanuts are legumes that grow underground in moist environments, making them highly susceptible to mold. These molds produce aflatoxins, toxins linked to liver damage, and an increased risk of cancer. Even if you're not allergic, peanuts can trigger inflammation throughout the body, worsening joint pain, brain fog, and putting extra strain on the heart. They're also high in omega-6 fatty acids, something most older adults already consume too much of, throwing off the omega balance and raising the risk of heart disease or cognitive decline. If you're taking blood thinners like warfarin, peanuts can be a nightmare. They contain vitamin K, which can interfere with the medication's effects, increasing the risk of blood clots or bleeding. And don't assume peanut butter is a safer option. Most store-bought peanut butter contains hydrogenated oils, sugar, and salt, none of which people over 60 need more of. Even the natural versions can be tricky, as they're easy to overeat and hard to portion properly. My advice? Limit your peanut intake, no matter how much you love them. Your body will thank you for it. Finally, we come to the biggest enemy on the list, cashews. This might be the nut that surprises you the most. Cashews are soft, sweet, and often praised as a healthy snack. But after age 60, they can become a dangerous trap. First, cashews are high in carbohydrates, about 9 grams per ounce, but very low in fiber. This causes your blood sugar to spike and crash quickly, leaving you tired, sluggish, and unfocused. I once worked with Mrs. Mai, 66 years old, who ate cashews every day thinking they were better than cookies, but she couldn't figure out why she was gaining weight and feeling foggy after lunch. Once we removed cashews from her diet, her afternoon energy returned and her blood sugar stabilized within a few weeks. Cashews also contain oxalates, compounds that bind with calcium and block its absorption. For older adults, this can weaken bones and increase the risk of fractures. Oxalates also raise the risk of kidney stones, especially if your kidneys are already less efficient with age. And did you know? Raw cashews contain urushiol, the same toxic chemical found in poison ivy. They must be thoroughly steamed or roasted before being safe to eat. But many cashew products are still roasted in oil and salted, adding unnecessary fat and sodium. Cashews are also easy to overeat because of their soft, creamy texture, which can lead to consuming far too many calories without realizing it. Cashews also contain enzyme inhibitors, which interfere with protein digestion and may lead to muscle weakness and fatigue over time. So, if you're looking for a nut that supports blood sugar, bone strength, and digestion, go for almonds or walnuts instead of cashews. They nourish your body, while cashews, unfortunately, act more like a distraction in disguise. Now, let's take a moment to reflect on our journey. You've learned about 4 amazing nuts: Brazil nuts for thyroid health and cellular aging, walnuts for memory and sleep, almonds for bones and heart, and pistachios for blood pressure and eye health. You've also discovered 4 nuts to limit: macadamias, which stress the gallbladder; pine nuts, which interact with medications; peanuts, which cause inflammation and contain toxins; and cashews, which spike blood sugar and weaken bones. Each of these small choices matters. They influence how you feel, how you move, and how long you can live independently. I've seen patients like Mrs. Lorraine, Mr. Hillary, and Mrs. Venus regain clarity, strength, and joy simply by changing the kinds of nuts they eat each day. Your body after age 60 becomes more sensitive, but it also responds more positively to the right choices. So, let me ask you, this week, which nut will you add to your daily routine? Which one will you let go of to protect your health? Share your answer in the comments. I read every story, and they inspire others on their own health journeys. If you found this information helpful, please hit the like button, share it with your loved ones, and subscribe to the channel for more health tips for your golden years. I'll see you in the next video, where we'll explore more foods that can transform your life. Stay strong and full of energy.